Good morning or good afternoon, depending on where you are. And thank you very much, Attila. As Attila said, my name is Kate Mahoney, and I'm a consultant working with the UNHCR Child Protection Unit in Geneva on child protection in urban contexts. And I'm here together with my colleague, Igor, who works in Indonesia in the Jakarta office. This webinar will present the findings from a recent review, Child Protection Risks and Resilience in Urban Settings, which has been funded generously by the U.S. Government Bureau for Population, Refugees, and Migration. Igor will be highlighting how UNHCR Indonesia is addressing the specific challenges that they're encountering there in terms of protecting children in urban contexts. I'd like to just give you a quick overview of the presentation. I'll provide a little bit of an overview of the project itself, and then share with you the findings on urban child protection risk and resilience, and highlight some of the programming gaps and good practices that we identified. I'd like to particularly draw your attention to 5 key investments that we identified through this study for children in urban contexts. And then I'll hand the floor over to Igor, who will talk more specifically about the situation in Jakarta and the strategies that they're employing to tackle some of those challenges. And then we'll have plenty of time for questions and answers and hopefully a lively discussion. As most of you know, more than half of the world's approximately 16 million refugees now live in urban areas. And of course, that number is expected to increase due to the current urbanization trend. Many of these urban refugees are children. Now, UNHCR's urban refugee policy and the UNHCR Alternatives to Camp policy emphasizes refugees' right to protection in cities and the responsibility of UNHCR operations to pursue alternatives to camp whenever and wherever possible. And the UNHCR framework for the protection of children sets goals for the protection of children that apply in all contexts, including urban settings. These policy and strategy documents establish a framework for protection of children and adolescents in urban situations, but they actually do not fully address some of the key strategic and operational issues that are relevant for day-to-day work, such as what are the urban protection risks and resilience factors for refugee children, what are the gaps in current UNHCR programming, and what's working? And finally, how can UNHCR invest most efficiently in programming to mitigate protection risks and strengthen existing protection mechanisms? So BPRM has supported UNHCR to undertake a phased project focused on protection for vulnerable children and families between May of 2015 last year and September 2016 of this year. The aim of the project is really overall to enhance protection and resilience for urban refugee children by understanding the protection risks and resilience factors and exploring what are the most effective approaches for child protection in urban areas. And finally, developing a toolkit and guidance to support urban field operations. Just a quick reminder of how UNHCR defines protection of children. So this project is focused on the UNHCR definition of protection of children, which is slightly different than the definitions that may be used by the Child Protection Area of Responsibility or other groups, in that it encompasses a broader concept of protection for refugees, including access to services and procedures related to asylum, and it also includes solutions. So just to summarize, the definition of protection of children is responding to children's specific needs and the risks they're facing, including protecting and advocating against all forms of discrimination, preventing and responding to abuse, neglect, violence, and exploitation, ensuring immediate access to appropriate services, and ensuring durable solutions in the child's best interest. And it's important to keep in mind that this definition holds in all contexts, including, of course, urban settings. So just a quick overview of the project itself. It encompassed a desk review, which included over 60 key informant interviews, as well as a literature review. And the literature reviewed include reports from NGOs, UNHCR, academic articles focused on child protection in urban contexts and concepts of resilience. Of course, the key informant interviews were really central. And the field missions included consultations with children, focus groups with partners, parents, and interviews with UNHCR staff, as well as testing of tools and guidance. So far we've had field missions to Bangkok and Jakarta, and we have planned field missions coming up in the next couple of months. The focus over the next few months will be on developing and testing and compiling tools and guidance that can help us to improve programming for children in urban areas. So the key research questions that this project has focused on is looking at overall, what are the benefits of cities for families and children? What are the difficulties and risks for for children? Resilience. How are children able to stay happy and safe in the face of difficulties? And what or who helps them to do this? Which refugee children, girls, boys, children of different ages or ethnic groups or characteristics, seem to be thriving or seem to be having more difficulty in urban contexts, and why? And what are the protective services and support networks that are being used by refugee children and families or could be used by them? What are the gaps in terms of protective services and support for refugee children and families? How is outreach and access to information working? What information about risks, support networks, asylum procedures and timelines, et cetera, and durable solutions do children have access to? And how do they obtain and share this information? And finally, how is it working in terms of integration with the host community? What contact do refugee children and families have with the host community? Is this contact positive or negative? And how could we facilitate more positive contact? The project findings started off by looking at the benefits of city life for refugee children. And the literature and in speaking with practitioners and refugees, it's clear that there are potentially many benefits for refugees living in the city, although clearly this depends in large part on the legal, economic, and social context. Cities offer livelihood opportunities. Clearly there's a much wider range of services, including secondary and tertiary health and education, more specialized mental health services, child protection and legal services, services and support for children with disabilities. Refugees have an opportunity to be much more actively engaged in their own lives and their own livelihoods in cities than they would have in a camp environment. Especially for young people, the access to the internet and to information is much better in cities than it is in rural areas or in camps. And in some cities, there's very supportive communities of origin that can be important for refugees. Finally, cities are very dynamic places. There's tremendous diversity, and there's far more possibilities for integration and for freedom of movement and independence. In many ways, cities really offer refugees the opportunity to have a normal life. As one UNHCR staff member mentioned, an urban setting provides more opportunities to be not just a refugee, not to have your entire being defined by that status, but rather just a person in that place. And I think that's tremendously freeing. But proximity to services and opportunities does not necessarily equate to access. The benefits and advantages that are potentially available to refugee children and families in cities are countered by significant protection risks and challenges that are complex and interrelated. And this slide helps us to look at how these kind of overlapping child protection concerns come together in the center in terms of what refugee children are facing. So refugee children face many of the same difficulties as the urban poor, such as poor quality housing and slum conditions, limited access to education and other services, nowhere safe to play, poor transportation connections. So all of those difficulties that poor urban children have, refugees often share. Refugee children often have many of the same concerns that children face in humanitarian contexts. So dangers and injuries, physical violence, and other harmful practices within their communities, or simply in the urban environment, sexual violence, psychosocial distress and mental disorders, children associated with armed conflict or armed groups, child labor, unaccompanied and separated children, and justice issues. But then refugees have an added layer. They face an array of additional challenges related specifically to their forced migration and their status as asylum seekers or refugees, which may involve difficulty with documentation, uncertainty related to asylum and resettlement procedures and timelines, limited legal access to services in their place of asylum, difficulty accessing work, lack of language and cultural fluency, risk of arrest and detention in some locations, and psychosocial distress related to conflict that they may have fled. And finally, lack of community-based support and social networks because those have been disrupted through their flight. At risk of stating the obvious, I think it's quite important to note that urban settings are fundamentally different than camp settings or even rural settlements. In urban areas, refugees are spread out. They are often dispersed across vast urban areas. They must find their own accommodation and make a living to pay for food and shelter or have some remittances, some source of income. This is quite different from a camp setting in which refugees are really condensed in one basic location, and there is direct provision of shelter, food, health, and other services, albeit quite basic. So analysis of information gathered from the literature and from consultations with key informants indicates that there's sort of 5 underlying factors specifically related to the urban context that contribute to multiple interrelated child protection risks or compound those risks. And those are the high cost of living and the difficulty for refugees to meet their basic needs, poor quality shelter, which is often in marginal areas, and it presents its own configuration of protection concerns, dispersed refugee populations, which makes it quite difficult for refugees to find a sense of community and build key social relationships. As a result, you have less cohesive and engaged communities, resulting in a lack of community-based support. And finally, the difficulty of outreach for UNHCR and partners or other actors to monitor the protection concerns amongst the refugee population and disseminate protection information. The UNHCR staff and NGO actors and the refugees themselves, as well as the literature, repeatedly emphasize these complex and compound linkages between financial difficulties, stress, negative coping mechanisms within the refugee community and amongst children themselves, and child protection risks. And they highlight how one problem, such as inadequate shelter or insufficient funds to cover household expenses or lack of childcare, can link to a whole chain of other child protection risks such as domestic violence, children dropping out of school, neglect, early marriage, gang activity, substance abuse, child labor, and survival sex. Child protection risks for urban refugee children raised by literature and key informants include the struggle to meet basic needs, interrupted education, difficulties with documentation, arrest and detention, children living or working on the streets, sexual and gender-based violence, early sexual activity, early marriage, early motherhood, children and families with disabilities having difficulty in getting the services they need, mental health and psychosocial distress, children in need of alternative care, and very much living in limbo, the difficulty to find solutions. So that's quite a laundry list. And I think it's important to really keep in mind that that laundry list is in fact real issues for people and that those issues interact. The extent to which refugee children and families avoid or mitigate those urban child protection risks and reap the benefits of urban life depends on a multitude of interacting factors. But within any given context, some refugee communities, some families, and some children seem to do better at making a life for themselves in the city than others do. What are the resilience factors that influence whether a child or family is able to mitigate or otherwise address protection risks in order to make it in the city? Now, when we talked to children and families and practitioners, we got this list, and it was fairly consistent, interestingly, among those 3 different groups. Everyone that we spoke to strongly emphasized the importance of family support, the emotional, physical, and financial care and support provided by parents, siblings, other family members, or nurturing caregivers. And everybody emphasized the importance of community-based assistance and protection, including faith-based support. And this really provides a sense of belonging, connectedness, shared values, and identity with the community. That provides spaces, structures, and services that support children, as well as individual support, such as food, housing, clothing, and medical care to help refugee families and children meet basic needs. Everyone also emphasized education and learning opportunities as absolutely crucial. This support to gain academic knowledge and credentials and to develop problem-solving abilities, life skills, social networks, and employment within a safe environment. Now, field practitioners consistently emphasized the importance of information on asylum procedures and potential solutions. And refugees also emphasize this quite a bit too, refugee children. See, the information and realistic understanding of the urban protection environment, so how to stay safe, as well as options regarding asylum, resettlement, and other durable solutions, in order that they can themselves make informed decisions. There's also a big emphasis on local language skills and cultural skills. So the ability to speak the local language and to act in a culturally appropriate way in order to study, work, build social networks, and protect oneself. Children particularly emphasized those points, but they particularly emphasized the importance of peer support, of engagement and participation, the value of supportive friends, meaningful engagement, having something to do, having a purpose, a positive mindset were very important for children. Also, sports and recreation. The opportunities for play, sports, dance, other fun, active ways to get together with peers, forget troubles and focus on developing a talents came out very loud and clear as something that was really important for children from their perspective. And mobile phones and social networks. Phones as a digital tool to help navigate the city, decipher local language, store personal documents, watch football, play video games, communicate with friends and family, and network with other asylum seekers and refugees. Mobile phones were really a lifeline. So in reviewing and designing programming, it's really important to think through how the program is enhancing and strengthening these factors for refugee children and families. When we really looked at project findings and the programming challenges and gaps, as well as what's working, we saw that safe spaces for children, that there's a huge need for that when those safe spaces are there, it becomes a very important gathering place for children, that many operations highlighted that as something that was difficult to provide, particularly in urban areas because of the cost of space. Alternative care for unaccompanied children came out as one of the biggest gaps in almost every operation that we spoke with. And there's agreement among all operations that this is really a very serious gap, and the needs include funding to cover the cost of safe accommodation, recruitment of suitable guardians to supervise and provide emotional support for children on an ongoing basis, and mechanisms and programming to ensure that unaccompanied children are able to access services, are not isolated, and are able to get emotional support from their peers and their community of origin. Economic strengthening, including livelihood support and cash assistance, were obviously critical, and in many contexts in the host country is not open to refugees working or starting a business, which limits the viability of livelihood support. In many cases, UNHCR is providing cash support in those situations. Mental health and psychosocial support came up as another gap, in the sense that at the operational level there are some very good examples, but overall we can say that there is so far only kind of limited programming that explicitly strengthens peer support amongst children, or that reinforces the abilities of families and communities to provide love and care and protection for the children, including foster families. In practice, there's really a need for more programming, such as positive parenting, psychosocial outreach, or peer outreach and protection schemes. In terms of learning opportunities, efforts to mainstream refugee children into the national school system are progressing in many locations, and it's a very positive development. However, at the operational level, there's still a gap when it comes to preparing refugee parents and children for attending national schools, and also preparing national schools to receive refugee children and support them to learn. There's also a gap in terms of really ensuring a full and flexible range of learning opportunities for those children, for whom the national system may not be the best fit. There's a need to also identify a network of affordable service providers that can provide mutual support and assistive devices and inclusive education for children with disabilities. In terms of SGBV prevention and response efforts, at the operational level, there's many good things in place, but there's also a need for holistic programming that provides safe spaces, learning and opportunities, peer support, and trusted adults for children. So overlapping with some of the other key programming that needs to be in place. Finally, overall kind of holistic asset building programming for teens. So programs that provide comprehensive support that address literacy, numeracy, vocational skills, sexual health, life skills, and help them to build their financial, social, physical, and emotional assets, help them to develop their talent and develop themselves as a person. And to participate in the design and implementation of projects, but also to participate in the community, to participate and engage as much as possible. So some of the ways of working that staff members and partners identified as being really effective, they're challenging in urban context, are outreach. Many operations highlighted the lack of effective outreach and that being a challenge. Links to the child protection system at the local and national government and with local NGO actors and services. So really facilitating links to existing services rather than providing services. Effective approaches to engage and strengthening community-based protection of children. So trying to map what's currently in place in the community and support those resources has been very challenging in urban areas, in part because these communities are quite dispersed. So the overall conclusion that has come out of the study is that really in order to address these gaps and pursue the promising practices that have been identified, there's a need for urban operations to employ new ways of working that have been, and this is consistent with the other policy and guidance that has come out in other areas of work in terms of other sectors in terms of urban settings. So there's a real need to shift from delivering services to facilitating connections to quality services, to build a local and national child protection network, both with state public services as well as with private or non-governmental organizations, and to develop the child protection capacity of organizations and individuals. And that includes also an understanding of the specific challenges that refugees face. And finally, to actively engage children's, families, and communities' capacities. In order to address these gaps, and as an outcome of this project so far, we've identified 5 key investments for protecting refugee children in urban settings. And this really encompasses kind of a systems approach to child protection. So it's very much fostering children's own protection by investing in relevant education and skills, really investing in real peer support and facilitating that, supporting children and teens' participation and engagement, and investing in targeted asset building for adolescents. The second key investment is to support families, to support children. And this includes both natural-born children as well as children who are in a family's care through economic strengthening, through positive parenting, and through effective and supported foster care. The third investment is strengthening community support mechanisms through outreach, through supporting or facilitating safe spaces for children of all ages, including childcare, after-school programs, and places for youth to have a safe space to explore their identities and engage with other youth, community-based protection, and social networks. So really supporting children and youth to create and strengthen social networks in these urban environments. Investment 4 is facilitate access to local child protection systems and services. And this is really key in terms of that facilitating role rather than providing services. So the first step is clearly mapping of existing services and networks in a given urban area. And that's easier said than done. It's time consuming, but it's a critical step. Providing children, families, and youth information on asylum solution and services so that they can really make realistic decisions about how to manage their lives in the city. Advocacy for access to local child protection system, capacity building for local providers, which can be done also in an area-based approach. So looking at what capacity can be developed that would benefit both host and refugee populations. And finally, ensuring minimum child protection services are in place. So looking at, again, this is kind of targeting some of the key aspects of the UNHCR role, addressing detention, and ensuring there's alternative care for unaccompanied children, case management, including best interest assessments and best interest determinations, as well as referral to a network of services, mental health and psychosocial services, addressing specific needs of children with disabilities, and making sure that there's prevention and response services in place for sexual and gender-based violence. That kind of concludes the section of this webinar that's focused on this global study. At this point, I'd very much like to turn the presentation over to my colleague Igor, who's going to share with us some of the contextually specific challenges that they're dealing with in Jakarta, and how they have made this shift. It's a really interesting example of an office that has made and is making this shift to a more facilitated approach and is trying to structure its program around these 5 investments for child protection in urban areas. Igor, I hand the floor to you.
Hi everybody, this is Igor Vorontsov talking from Jakarta, and just to briefly introduce myself, I'm a protection officer responsible for child protection and community services. I'm actually less than a year with UNHCR and worked for 15 years mostly with NGOs, with UNICEF, and always in an urban setting on child protection, human rights advocacy. Actually, I would not be able to compare our operation with maybe what you would call classic, or some people would call classic refugee setting. Here, in my view, we have quite peculiar operational context here in Indonesia and in Jakarta. It's a relatively small caseload. We have just over 13,000 persons of concern in total, and this is kind of small and tidy. So it should be much less hassle than what we have elsewhere in Jordan or in Turkey, where things are really tough. But here we have an example of an operation where, although the number of persons of concern and of children is not particularly high, but then accordingly the budget that operation has is actually very, very small. So what we have found is that we have huge difficulties to provide protection for everybody who really needs it. So I don't know how the typical for UNHCR, but this is example of a small operation, but still we are struggling to find resources to deliver effective protection. And talking about Jakarta, we have just 735 children in total. Like 2/3 of them boys and 1/3 of them girls. Although it's not a big number, but actually the operation has faced a number of challenges. Well, let me also tell you that Indonesia is very, very vast territory. We have like 17,000 islands in the ocean. So although the number of refugees, asylum seekers is not huge, but outreach is incredibly challenging because travel takes a lot of money, and if you want to provide protection to children, first we need to assess vulnerabilities, right? We need to do monitoring, and that's what is quite a challenge. So we are trying to go through partners, but nevertheless this disbursement plays a huge role. And what we have is that a lot of children and other persons of concern, they live either on their own or in detention or under the care of International Organization for Migration, where they would be placed in community accommodation with good support. And also I would mention that maybe Indonesia is not terribly typical, that while we do have mandate for protection of refugees and specifically children, but IOM actually happens to have much more money, times more money than UNHCR. So we find ourselves being kind of legally, so to say, the guardian and in charge, but in reality, is IOM is where we come to support, and where we are lucky to have quite good partnership with IOM, but it's quite difficult without resources here. Okay. Also, I would like to tell you that most of our children, they live either independently or they're in detention, or if they're families with children, especially if they're with their families, then they can benefit from IOM-funded accommodation. But to many vulnerable cases, we are not really in a position so far to offer so much needed assistance, so that they find themselves homeless, and then about maybe 30, we have maybe 30 kids every month self-reporting to the immigration officials to be detained. So we have a phenomenon of self-reporting when children and adults approach the immigration officials and request to go in detention just to have roof over their head and to have some food. However, some of them also understand that at some point they might be eligible to be transferred to non-detention accommodation, to the IOM facilities. So maybe some of them self-report with the view that actually they might access better benefits at some point, but detention is always a challenge. It's never good, so we are struggling with the detention, the phenomenon of detention, as much as possible. And we belong to the operations where detention strategy, end of detention strategy is rolled out. Now, if I draw your attention to the slide, well. You will see that, of course, the big challenge is the disbursement across cities, and there is a lot of isolation of children and youth from each other and from their communities. Also, if you would imagine, we don't have refugees who just cross from neighboring countries. We have refugees from over 40 countries who somehow find resources, and usually it's quite a lot of money to be able to fly to Indonesia. So it's a little bit unusual caseload, so it's mostly individuals who arrive here. And imagine when we know that most of these, for example, Afghan boys, the teenagers, they arrive here after their families probably they having paid like $7,000 to smugglers to get them here, and then these boys present by the office that they're homeless. So you can imagine what kind of dilemmas and how much we need to evaluate the situation to really figure out who is in most need of assistance. But perhaps this lack of homogeneity and cohesion within the refugees, within children, also contributes to the isolation. There is maybe less solidarity than elsewhere, there is a lot of competition within refugee communities, but of course there are many good people, many charitable people who agree to help in child protection, to be partners in child protection to some extent, and we work with community leaders. But on the other hand, there are a lot of smugglers involved. There is probably some level of black economy going on. So there are all sorts of people within refugee community, and it's not easy to engage, to encourage volunteerism as in some other contexts. So we have a lack of social cohesion in the refugee groups here. And then talking about unaccompanied children, then we have a huge, of course, issue of alternative care. Because we don't have developed system of foster care. It's incredibly difficult to find suitable foster carers, and then most of the adolescents, they end up surviving on their own, while of course we are trying to do as much monitoring as we can, and then many of them in detention, unfortunately. And the main driving force, perhaps, that people fly all the way to Indonesia is expectation for resettlement, because we are one of the operations where resettlement is still going on. And in terms of numbers, most of our persons of concern, they come from Afghanistan, Somalia, these kind of countries. And many of them have hopes of resettlement. However, Australia is also quite close by. So perhaps these are some of the driving forces here. And children, they don't bother so much to really make it survival here in Jakarta. And also because children don't speak the local language, Bahasa, then we have incredible difficulty to get them enrolled into local schools. So, and a lot of them spend here like 3-4 years easily, and they're still reluctant to enroll children to school. And this is our huge task, our huge priority now to encourage them to understand that you know they're here for quite long. Attila, do you think we can have next slide? Sorry, or maybe wait a sec. Maybe I can. Okay. Now I think I figured out how to. Yeah. Okay. So and then Kate already was talking about the key investments, and this is a very good structure that I also so much like, and we find it useful for our operation. So if you look at investment one, it's all about building children's resilience. So it's all about investing into child's own protection skills. And here, of course, accommodation comes first. Our operation has been struggling to find suitable accommodation, but what we also found very useful is to put children, especially older adolescents, into group accommodation where they can be involved in community activities, to cook and socialize together. Now, participation is hugely important from my experience in previous projects, and that's what we are trying to also to roll out here in the operation. Recently, we have drafted a child protection strategy that looks at different aspects of protection, and we are going to pilot a couple of parallel avenues for seeking children's opinions. One avenue is already well known to all of you, is our usual elected bodies of refugees, community representatives, and for example, in the children's shelter, we have a shelter president and all sorts of elected officials, so to say. But by the way, we are having here 2 shelters for unaccompanied children, just 2 up to 80 unaccompanied children we can host as UNHCR with our partners here in Jakarta. And unfortunately, whoever comes next then really risks to be homeless. Yeah. So the first avenue is through elections, through democratic participation. But another avenue that we are going to launch is a permanent consultation forums for children, because besides all this democratic business and all this kind of voting, which, as you know, also has a number of challenges, we would like not to have consultation with children once a year, but to have it on a regular basis, perhaps a couple of times a month. We would like to seek children's opinion about very current issues, about our protection dilemmas. And this is also an opportunity for children to voice their views. And again, you see that we are highlighting the challenge of children who are not in school. So in our operation, we are looking for alternatives. We are building partnerships with Refugee Learning Center, usually with NGOs, and also because of lack of meaningful activities for older children, we encourage learning centers to be open to community activities, so that the learning centers, they also serve as community centers. We found it very, very useful. And about the local language, of course, this is hugely important for us and very difficult to motivate children. Now, for investment 2 is about families, of course, and as all of us know, it takes a village to raise a child, and it definitely takes a family to protect a child. So actually, we have incorporated child protection unit unit into community services team, into community-based protection. So we believe that the best way to protect children is through protecting their families, or of course we would love to find good caretakers for or caregivers for unaccompanied children, because it is a default better solution. However, we, as I said before, finding foster families as such, especially formal foster families, is incredibly difficult in our operation. So one of the strategies we are using for adolescent boys, for example, over 15, is to put them into group homes, or we call them shelters. We are also experimenting with supported accommodation, the kind of rented apartments where a social worker would monitor them, but that's maybe for 16, 17-year-olds. While children over even 13, 14 still would go into the shelter. But for the future, we do realize that we are trying to expand the pool of caregivers and foster care providers, and hopefully in partnership with the government we'll be able to do that. Okay, let's go to the next slide. In terms of community support, we are talking about two communities that are important for child protection. Of course, normally we think about refugee communities themselves, but as I have noticed here in Indonesia, because it's not camp, and this is so much a kind of mixed bag, and you have so different people among refugees that it's quite difficult sometimes to they don't, in my impression, often have community identity, or they're quite separated and segmented. So there are a lot of challenges, but nevertheless, we have reached out to such parts of the community that could be positive child protection actors, and we do work with these communities, including to look for caregivers and to provide education. Okay, so in terms of local community, we have come across certain stereotypes about refugees. So of course, here we find our role also to engage in peace-building activities and mutual understanding, but the role of local community so far has been less than we would love to see. And then in terms of local child protection systems and services, that this is quite classic, that you already heard from Kate, is that we have done mapping of relevant actors here in Indonesian cities, and we continue to do this mapping as the context changes. And we are doing a lot of advocacy with the government, with the ministries, to take more responsibility. And we are also working to provide more child-friendly information for children and teens, because although they are driven by resettlement hopes, but they have very little accurate information, and there is a lot of anxiety. And finally, I would like to talk about this minimum child protection services that Kate already raised, that goes throughout, from community to the government. And here in our context, we have discovered that mental health and psychological support plays a huge role, and we would love to find more resources to support our children and their families psychologically, especially given the cultures they're coming from. A lot of distress we are finding here. And then something quite important I would like to highlight about case management, because we all love the idea of case management, and we are signing up for this idea as an organization. But in the Indonesian context, for example, what we found, we have some difficulty with the level of identification, because in our context, when we have very, very little resources, so we are committed to providing assistance to the most vulnerable first. So the problem is that we need to really individually assess all the at-risk children and to figure out who are the most vulnerable, and then to reach them with services. But then what we found, we don't have enough resources to do vulnerability assessment for a lot of at-risk children in detention, for those of them who are in hard-to-reach destinations. So in the end, this notion of focusing on vulnerability is also difficult to implement because we, as a result, we reach those who we can reach, and then we don't reach those who we cannot reach, and we sometimes don't know who is really the most vulnerable. And then, of course, as I said, we are working a lot on the issue of children and detention. We are advocating for ending child detention. There is hope. There is end in the light of the tunnel for Indonesia. And we are working hard on alternative care options for those who are in detention. So I would say that these are the main points that I would like to make about Indonesian context, and unless Kate has some more remarks, then we can open for questions and discussion.
Thank you, Igor, for the presentation. As you said, Kate, please step in if you have any further comments to add. Or other than that, the floor is open to participants. So if you have any questions, please use the hand icon to indicate that you want to talk to us, or put any questions you might have in the chat box. Okay, I see one person. Nan, I see your hand. Floor is yours. Nan, can you hear us?
Yes, I just put a chat, but don't worry. Child protection and child rights. It is the mandate of UNICEF, isn't it? Are we partnering with UNICEF on the ground?
None. Just in terms of sort of what this is Kate speaking, and in terms of what I learned through the global study, there is partnership in some and close cooperation in some locations, and less in others. So it's not 100% consistent. And I think I know maybe Igor can speak a bit more. I know there's quite close cooperation in Jakarta, so he may be able to speak to that specific context.
Well, look, I think it's really case specific, as Kate said. In our situation, UNICEF mostly is working with the Ministry of Social Affairs, Ministry of Education. They're very much on the policy level and standard setting. For example, UNICEF rolled out the minimum standards for child protection here in Indonesia, together with the government, which is of huge interest to UNHCR, of course. So I think there is quite a nice division of labor, so to say. You know, a partnership is potentially very good, but UNICEF doesn't work on individual cases. UNICEF has own mandate, so I think that depending on your operation, perhaps you could negotiate quite practical, quite healthy partnership.
And just to add on that, I think one area where we identified real potential for closer cooperation is in building closer relationships with key ministries that are working on children's issues. For example, the Ministry of Education or the Ministry of Social Welfare, or whatever ministry is focusing on child protection. UNICEF often has quite well-established relationships with those ministries, and I think closer cooperation between UNHCR and UNICEF in sort of introducing UNHCR to those ministries and building facilitating a closer relationship in the interest of refugee children could be quite beneficial.
Thank you very much.
Nondo, you have your hand
Yeah.
up. The floor is yours.
Yeah, I have a couple of questions. Like, there are some three questions that I would like to ask. And one of them is how case management will become a challenge in fostering child protection in Jakarta. And the second question is why those kids are in detention. Is it because they are in conflict with the law, or is it because there is lack of facilities? But also my third question is how does UNHCR and the partners plan to respond to other challenges in the near future in Jakarta?
Okay, should I reply? I've heard clearly question number 2. The sound was distorted a little bit on first and third. But let me just start with number 2 that you addressed about Jakarta. In terms of detention, we are talking about immigration detention. It's immigration detention, which means that such children and adults who are found in breach of immigration law, they are subject to be detained, of course. Mostly it happens when they try to irregularly cross the border, trying to enter or exit the country. So there's no link with criminal activities. But in case of Indonesia, we have quite cooperative government, and we have good understanding that children who are of concern to UNHCR, that we are really advocating for them not to be detained, and when they go around the cities with our refugee cards, then actually they are somewhat protected from detention. But of course, those who are caught on the border, yes, they are subject to immigration detention.
Thank you, Igor. The rest of the questions were not clearly heard. Nondo, if I may ask you, please kindly put your questions in the chat box, and we will address them separately, because the voice is not as clear from your end. Arwa, you have your hand up. So floor is yours, please. Arwa, can you hear us? Apparently not. So I would also ask you, please, kindly to put your question in the chat box. There is an issue with your microphone. Igor, Kate, I have put a question from Tizazu to you in the chat box. Please start with that.
Igor,
Okay,
do you want to address that? Yes, it's Jakarta specific.
Yeah. Well, I don't know, maybe there was a misunderstanding. As I was saying, the reason why most of children in Indonesia have no access to education is not so
Excuse
much
me, Igor.
because of government.
Sorry, Igor. Can you please read out the question? Thank you.
Oh, okay. Sorry, yeah, that's very logical. Okay, so we have a question from Tizazu Yizengaus. Sorry if my pronunciation is correct. Now, creating access to basic services is one of the child protection strategies, Tizazu is saying. But I see that 90% of children in Indonesia have no access to education. What is the unique challenge for this? Tizazu is asking. Okay, so let me highlight that our greatest issue is a challenge to encourage parents to learn the local language, because education is available in the local language, in the national language of Indonesia, which is Bahasa Indonesia. So we have been successful in such cases when children do speak the local language, the national language, to negotiate with schools and with certain levels of government that they can access education. There are still issues with some, with certificates because it's connected to the government issues ID. But as I said, the biggest issue is lack of fluency in the local language and lack of willingness on behalf of teenagers and children with families to learn the language.
If I could just add to what Igor said as regards education, it was really found in the global review that it was a challenge in many locations, in part due to language, and that the challenge for UNHCR operations and partners is to look to really expand the education options, look for new partners, new resources. So while we want as many children as possible to be able to attend the national school system, for some children that may not be a good fit, as I mentioned earlier, in which case we want to have as wide a range of learning opportunities as possible, so that children can have some education, some learning opportunities. With the hope, of course, that accreditation would be the first choice. I see the next question there is also Jakarta-focused, Igor, that Attila just shared with us. I think it was from Inar Abdul-Gabar. Is there any family tracing taking place in Jakarta, is the question. So perhaps you can share information on that with us.
Igor, are you with us?
Hello. Okay, something happened with the sound. Sorry. Okay, something happened with the sound. Actually, I was talking. I thought I was heard. Yes, we are working with the ICRC as needed on family tracing. However, most of our cases of our children are aware of contacts, of what are the contacts with their family. So it's not required that often, but yes, we do family tracing as required. And also, for example, in the case of Rohingya in Myanmar, we are working with our UNHCR colleagues in Myanmar to help because ICRC has less capacity to do tracing there.
I see some hands raised. Perhaps we could continue with those. Charu, the floor is yours.
Good morning and good afternoon, Igor. My question also actually related to the education where you said that 90% children were not in school due to the language issues. Here in India, we are able to have access to schooling as you mentioned. We are able to get children into primary schools where they're able to pick up the language much faster. However, the challenge comes in getting admission into middle and senior secondary schools, where we even having, other than the language, the issue of documentation, certificates and all. So as Kate also mentioned about looking for alternative resources and partners. So we've been looking at, one is I would like to know how you're looking at the language issue in terms of getting children into schools, address that. And secondly is about, I'd like to share that here we have looked at an option of the national open schooling system, wherein children in the secondary and senior secondary school level are being enrolled to give their exams.
Right. Thank you for the question. I think the concept of open school is very interesting, and frankly speaking, we as we have very dispersed population, we have just a bunch of kids in every location. It is true that the challenge continues. We can negotiate with specific schools, but on a national level, there continues to be issue with certificates. And if we enter into discussion tomorrow with the Ministry of Education, probably we don't get immediately traction because it's mostly for Indonesian national children. But in terms of language, well, I understand in India it may be a little bit easier because English is used widely. Here, as I was saying, the proficiency in Bahasa is a huge issue, and we are working with partners, first of all, to encourage refugee communities that they need to plan to be here for a while. They should not they should not lose this time. They need to use this time productively, and through community initiatives, through learning centers and learning centers. We are promoting learning the local language, but that's a little bit generic. What I can say right now.
Mm-hmm. One other question was on what the best mental health, what all are the mental health initiatives that you're taking in terms of with the UAMs and other children, particularly the youth?
Sorry, could you repeat about mental health support?
Yes. What are your initiatives that you are undertaking with the UAMs and also with the youth?
Well, what we have found in Indonesia, and this is very consistent on the guidance note from the DIP, if you look on the mental health support, is that we don't focus too much on the clinical, so to say, counseling level of psychological mental health support. We have found that mental stability of our kids depend a lot on their productive lives, on how satisfied are they, what is their level of stress. So we have been working with partners to provide extracurricular activity, to provide sports, to provide creative activities, for these older teenagers. And we found that this is a great tool to boost their self-confidence and to prevent, major psychological problems. But we have a certain number of cases where indeed there is trauma, there is mental health trauma, and for this we engage specialized professionals. We have a number of consultant psychologists. We are working with the local public health system, national public health system, and we have access also to psychiatrists as necessary. But again, to highlight, in our experience, a lot can be prevented by simply building capacity of these children, reinstating their belief in themselves and addressing their stress, addressing their loneliness, their lack of contact with parents. So more through community activities rather than through medical activities.
Thank you so much.
You're welcome.
I see we have another question from Joanna Wedge, asking also for you, Igor, saying, I would like to know more about how UNHCR Indonesia works with IOM. How have you divided up the work given the different mandates, and are there any lessons there for other countries? Igor, I think that's to you.
Right, I see. Well, I feel embarrassed that most questions come to Indonesia, not to our global expert, Kate. But if I have to, this is a little bit sensitive topic, as it's about institutional mandates and whatever politics may be between IOM and UNHCR. But actually, we have been quite lucky in a way that the division of work quite clear. UNHCR has almost no money. So whatever requires money, frankly, is likely to be given to IUM. For example, IUM is administering the biggest scheme here in the country of alternatives to detention. So, whoever is arrested for immigration reasons, sooner or later will get access to IUM accommodation. That's quite quality accommodation with good support provided. So, for example, IOM is working in the places of detention. They provide certain medical monitoring, medical service. I am actually maybe not the one who knows all the nitty-gritty about other protection work, not child protection with IUM. But I'm just sharing with you what I'm aware. So just as a rule of the thumb, when it comes to mandate, when it comes to advocating vis-a-vis government, when it comes to issuing legal IDs, then of course it's UNHCR, and we are doing protection intervention. But when it comes to be present in the localities, in the IDCs, in the distant locations, we have to rely a lot on colleagues from IUM. Of course, they have different training, they have their own kind of standards, SOPs, but we are working together sometimes with challenges to build common understanding, and often when they relay information to us, we are able to act on it. So it's a good partnership. Okay, should we have last question?
Dora, I see your hand. The floor is yours, please.
Thank you very much. I would like to inquire about how can we provide immediate response to alternative measures for case management in supporting children at risk within the IDP community. In some situations, the local government lack the capacity and the expertise, and by the time we provide such capacity training, it requires some duration. So at that meantime, how can we find alternatives to process case management activities in order to provide best solutions for children? Thank you.
So I'm afraid that your question is running a little bit outside the scope of the study, and that the study was quite focused on asylum seekers and refugees. So I haven't focused a whole lot on providing immediate response for IDPs. I think that perhaps that question would be better focused on a forum dealing with IDPs or case management. So I'm afraid I can't really address it directly. And I'm sorry about that. Do we have any other questions?
I just put one more in your chat box. Please let me know how many do you want to address further. I have about 5 questions still.
Okay. Sarah, with Church World Service in Nairobi, had a comment. The urban refugee students attending public schools experience discrimination and stigmatization from teachers and fellow students. Interventions aimed at teachers, mainly from local host community, would be helpful. I think that is a really valuable comment, and I think an issue that came out a little bit in Jakarta, but certainly in many other contexts that were part of the study, was the issue of discrimination and xenophobia in terms of access to school, in terms of feeling comfortable in schools, and in terms of violence on the streets, etc. So in terms of public schools, I think that type of cooperation, as you suggest, would be very, very valuable. Building relationships with the host community and then working together, refugee community and host community, to work together with the school, kind of creating that triangle between community, school, and families and children would be very valuable. That's certainly a valuable idea, and I would be interested in talking to you more about that if you have specific examples of where that may have worked. So thank you for sharing.
Thanks, Kate. Do we have a few more minutes, or you would like to wrap up?
I have a couple more questions. I'd be willing to take a couple more questions. I appreciate that people have had so many interesting comments and questions, certainly. So I know some people may have to go, but if there are more questions, I'd be happy to address them. And I imagine Igor would be also.
Great. Philip, floor is yours.
Great, thank you. Thanks, Igor and Kate, for your interesting presentation. I'm a consultant with Comprehensive Solutions Unit in DIP at headquarters in the Rule of Law team. And I'm interested to find out a little bit more detail from what you learnt in the study about the way in which children in contact with the law use the justice system, and what were some of the challenges you identified and some of the good practices in linking children with better outcomes and mitigating protection risks. And when I say accessing the justice system, Igor, I'd like to find out not just in terms of detention for migration or in migration detention, as you spoke about, but just generally children in contact with the law in a general sense.
Philip, in all the discussions I had, that issue actually did not come up.
Right, okay.
It came up in terms of detention, but in terms of the priorities that practitioners and refugees and partners highlighted in terms of urban context, that issue did not come up, I don't think, once.
Okay.
So I don't have a lot of interesting comments on that, I'm sorry. But I think it's perhaps because other issues were highlighted as sort of a priority in terms of bigger impact on a larger number of people.
Okay. Right, and if I would just add, well, it's kind of interesting in Indonesia because we mostly deal with immigration, so to say, violations, immigration detention, so to say, but we actually observed that the police is very unwilling most often to intervene at all. For example, when POCs are doing some disruptive activities or, whatever might constitute a problem with public law and order. In some countries, people will be whisked away and arrested. Here, actually, police is a little bit hesitant sometimes to intervene. So, in one way, we are happy that they respect, human rights of refugees. We are not sure exactly what are their motivations, but just addressing your question. The issue here sometimes is that the law enforcement does not react rather than overreact. And another maybe small thing is that we have run sometimes into issues with the local authorities when children or generally persons of concern have entered into a bit of conflict with local communities, local authorities involving some level of law enforcement. And I can just give you a specific kind of very strange example. This is Muslim society here, right? And personal life is very much regulated. For example, I think when we had one of our minors who had a relationship with a local girl, which was consensual and everything. So it was actually not a crime under Indonesian law, but we actually had a lot of issues. So there was a lot of negotiations. Why the boy was had a relationship with this girl, and people requested compensation and whatnot. So it's quite a peculiar context here. But probably your question refers to more classic justice systems.
And Philip, I was just running over in my mind, and I can think of a couple of issues that came up through discussions with key informants or the literature, and that was specifically arrest of street children in areas where there's a lot of child labor that's kind of based in the streets. So kind of harassment of children who are working on the street as an issue, particularly in I think Jordan and Lebanon, it came up as quite a big issue. Another issue is in terms of sexual and gender-based violence, fear of approaching the police to report incidents. In some cases, discomfort with the police and also concern about perhaps ending up in detention in contexts such as Bangkok or Jakarta, where that's a big issue. Fear of the police being such that it was just, fear reinforcing fear. And so survivors really were very uncomfortable approaching the police.
Okay. That's great. Thanks both for your insight. Is the study, Kate, that you've completed, is that going to be available through the Urban Good Practices website so I can access some of this information?
The study that's specifically, the paper on Jakarta should be available, and the full study is in the midst of getting revised, at which point, yes, it will certainly be available. And ultimately, it'll be part of a sort of final report and a toolkit with guidance.
Great. That sounds great. Thank you.
Okay. I see there is one question from Arva. That I guess I can quickly answer. Arva is asking that we talked about the challenge of identification of children at risk, and if we are using child-friendly spaces, recreational activities, and child-friendly committees and children clubs. Yes, this is something what our partners are using. When it comes to child-friendly spaces, this is more in settings close to camps, as we don't have camps in Indonesia, with the exception of reception centers in Aceh for Rohingyas. There, Save the Children, for example, they used, of course, safe children's safe spaces. But our implementing partners, they are, of course, doing recreational activities and running children clubs. So, of course, this is a methodology. This is a key approach to prevent psychological stress and to boost self-confidence and resilience.
If I could just jump in, Arwa, I think one of the challenges that I heard from many practitioners in urban areas is that outreach is quite difficult. So that it's in order to find the kids and get them involved in those type of activities, you have to be able to reach out to them in the first place. And that running child-friendly centers is often really prohibitively expensive in some urban areas just because the cost of space. So again, so just some challenges unique to the urban area that make it, not in every urban area, but in many urban areas, that much more difficult to use some of those strategies, sort of to have spaces where children come, and then once they're there, by working with them, you can identify who's the most vulnerable. It's almost turned around so that, in Igor's situation, he knows about X number of children, and the children he knows about are involved in activities, but I know he's concerned about the kids that he doesn't know about that are not involved in those activities.
Right. So just again to Arva talked the challenges of identification of children at risk. Basically, as we register everybody in progress and we have basic information, we have an idea who are at risk, but the problem is we don't know often to what extent they are at risk. We don't have resources and capacities to reach out and to do individual protection assessment. That's what troubles us often.
Attila, do we have any more questions?
I'm putting one more question to you, Kate.
The question from Bahima Karim says, how about community school where Bahasa can be taught by the community? And what are the good practices to handle high expectation of resettlement, especially this is one of the big challenges in Southeast Asia. So in terms of community schools, Igor can maybe speak more to that. I think that's something that he's been trying to work on in terms of, and I think that's something we would highly recommend in terms of using local resources to provide those key language classes. And in terms of the high expectation of resettlement, I think you're absolutely right. I think that is a big challenge in some, not all, urban areas. In some specific urban areas, there's a perception that being in that area creates a higher likelihood of resettlement. And then I think that in turn means that the refugees who are there are so focused on resettlement that they're quite distracted from what they need to do to successfully live in that urban area, and which can in turn put them at risk. I know some operations have really made a big effort to just send out a very consistent message that resettlement is not an option, as a way of helping and really helping refugees to refocus on their life in that city. And I think that's part of probably what Igor has to deal with, is that many of the refugee children and families who are in Jakarta were not expecting to be there for long. They were expecting to pass through, and now they're there for years probably. And that's a real mindset change of we need to figure out how to make a life for ourselves here. So I think you've really highlighted a really quite critical issue. And Igor, please do add if I missed anything.
Right. Well, on the second question, I would just add that, we have to face here the incredibly robust business of people smugglers that operate around the world. There is a huge business, I guess, involved, transporting people without documents from Somalia to Indonesia, from Afghanistan to Indonesia, and we don't really know how these smugglers market their services. Do they really tell these parents and kids that they're going to get American passport in a few months and they're going to resettle, or they're going to go by boat to Australia? So it is not really clear for us. Some children who arrive here, they are really very upset when they hear that they need to be prepared to spend not months but years here. Although, of course, UNHCR is looking closely at their vulnerabilities, and we can also try to do it quite quicker for especially vulnerable cases. But expectations are high, and we are a little bit in the dark. We are not sure how the smuggling business work, how exactly these people are briefed, and what are the rules of the game on their side. Now, in terms of community school, I only can completely agree. I mentioned in my presentation that we work with the community learning centers. We are trying to find these learning centers whenever we can. And the problem is that the refugees are dispersed across locations, and it's not nice like in a camp where you have everybody in one place and you can assign people to activities to invite them. So absolutely, we are encouraging communities to help refugees with Bahasa classes, but there is yet some gap to be bridged also sometimes between communities and the refugees. Also here in Indonesia, we have some sensitivity between Sunni and Shia, so a lot of peace building and confidence building needs to be done here still.
Thank you, Igor. No more questions for me. So if you don't have anything to add, I would wrap up the session and close the WebEx environment.
I'd just like to say thank you to everybody for your interest and your attention. It's been a pleasure to share this research and ongoing work with you, and I hope we can be in contact in the future. Please do contact us. I think we have our contact information on the next slide. If you have interesting comments or good practices or questions regarding child protection in urban context, please don't hesitate to contact me. I would welcome suggestions, ideas as we move to the phase of developing some guidance and tools and good practices.
And I also would like to thank everybody. Thanks for your time, and it would be great to stay in touch with those who have interest in child protection. If there is an interested group or community of practice, eventually it could be very, very helpful for all of us who deal with the same challenges.
And thanks to Attila for organizing us and keeping us on track.
Thanks a lot, Attila.
Thank you very much, Kate and Igor. Great presentation. Thanks for all the interesting comments and questions. The session was recorded and will be posted on urbangoodpractices.org This is a website maintained by the Urban Refugee Task Team. You have all the WebEx recordings. This was 11th in a row. So in few days you will have this recording posted there as well. Igor, Kate, there has been many questions on the presentation, on the slides, whether it will be shared or not. I leave that to you. Participants, you see Kate's and Igor's mail address on the slide, so if you need the presentation, please get in touch with them. Thank you again. Have a nice day, everyone. I will leave the session open, so if you have some further comments to add, please do so. Thanks and have a great day. Bye-bye.
Thanks and have a great day.
Thanks, everybody. Bye-bye. Take care.